My name is Dr. Lisa Vuich. I'm the owner of Renew MediSpa here in Derry, New Hampshire. The focus of today's brief presentation is going to be how we restore lost collagen with a technology that involves micro-focused ultrasound, and specifically a device called Sofwave, which again, we brought in this past October. It took Renew by storm so quickly, and we were so impressed with the results we were seeing in even just, 4 or 6 weeks time, that we actually brought a second device in December in order to meet demand for appointments and to not, have Victor, Julie, and I fighting over it, who's going to use it today. So we're pretty excited about this, very excited to tell you how it works, what it's all about, and so that you can make the best decision, as a potential guest, as a consumer. And regardless of where you are in your anti-aging journey, maybe you're someone who is younger and is just starting to see age-related changes, not ready to pull the trigger and do anything, but you just want to be educated. Or maybe you're someone who's older and is starting to look in the mirror and say, whose face is that, right? I do think that what I'm going to discuss today really has something to deliver to anyone on either end of that spectrum. So I hope that this will be helpful. The guy we have to thank for Sofwave is Dr. Shimon Eous. Now, if you're in the aesthetic field, you know this man. This is the man who invented, if you've ever had a photofacial, it's called intense pulse light or IPL photofacial. He's actually the guy who invented the photofacial, which is probably one of the very first tools we had in our hands, as aesthetic medical providers. So we all know who he is. He went on to found multiple aesthetic companies, big ones like Lumenis and Cineron Candela, and others, and then sold them off. Well, Sofwave is actually the latest technology that Dr. Eous has put into our hands. And so I always like to say, way smarter people than me came up with this stuff. We're just reaping the benefits of what Dr. Eous has developed. So I'd like to give him a little thank you, pay homage where it's due. And that's where this technology comes from. You might have heard a bit about Sofwave in the media. It's gotten some attention, especially last summer when Sarah Jessica Parker started talking about it, and that got a little tread out there. Apparently, people were starting to notice, on her latest TV series that she was looking really good, and they were wondering what she did. It turns out it was Sofwave that was getting her looking smoother and tighter. So it started to really get a lot of attention after that went online. So facial aging in large part is due to collagen loss. Now, it's not completely collagen loss, but collagen loss is what we see that causes, the fine lines and a lot of that skin laxity, sort of sagging skin. People say, my face is melting, what's going on? A lot of that is the collagen loss. And as we age, we're losing approximately on average 2.1% per year. The older you get, the faster you're losing collagen. The younger you are, the slower the collagen loss is. So it varies according to age. Now, there are also skeletal changes occurring. So there are some bony changes. We can't have any impact on that with any surface device or even with surgery. For the most part, we're not changing bone loss, but collagen loss is a big part of the picture. And so we really focus on that, especially in non-surgical aesthetics, in terms of what can we do to actually impact that collagen loss and to restore lost collagen. Unfortunately, you can't just ingest it. Okay, so a lot of people will come into the MediSpa and they'll ask me, well, what about this collagen supplement? What about that collagen supplement? I myself have tried a marine-based collagen supplement, but I've known clients who've done it over the years. I've never seen an oral collagen supplement make a difference on the face or the body, ever. And there are no clinical studies that prove, that happens. So I myself have tried it as well, but you can't rely on that to actually impact what's happening on what you see in the mirror. I would say anything you put on your skin that says it has collagen, there's no way those collagen molecules are penetrating. It's certainly not tightening. It won't lift anything, so maybe it helps with hydration. Maybe it helps joints. Sometimes I say to clients, well, we probably have smooth colons. I don't really know what else it's doing, but it's not going to help our skin. So unfortunately, topical and oral collagen is not our answer. So in aesthetics, especially in non-surgical aesthetics, what we focus on are procedures which are all about collagen induction. And that means that we want to stimulate the fibroblasts, the cells in the skin that know how to make collagen, to actually do it. The problem is our skin cells, our fibroblasts, are not motivated to do that unless there's an injury, all right? So a lot of non-surgical aesthetics is all about how are you going to create the injury? How are you going to do it without harming the surface? How big an injury can you create to generate as much collagen as possible in a single procedure? So that really, regardless of whether you're talking about radiofrequency microneedling, laser skin resurfacing, micro-focused ultrasound. These are all, even regular microneedling without heat, these are all just ways that we're trying to generate an injury to stimulate those fibroblasts to make collagen, which will then fill in and give us the smoothing and hopefully, if there's enough collagen, the tightening and the lifting that we want to see. The problem is with a lot of these procedures, you need to do many of them. So for example, let's talk about regular microneedling, where you go into a med spa or salon, you're numbed, and then they just use a microneedling device. There's no heat involved, and they're creating that micro injury. That certainly stimulates collagen. The problem is that it takes many, many, many of those, lower level procedures to actually give enough collagen to make a visible result. And so this is what I feel leads to procedure fatigue. So, you have a client, they've done 4 of them, they're seeing a minimal change. It's not that the change isn't happening. It's just such a small amount per procedure that it can seem like it's just going to take too long. There's just too many procedures needed. It's not something I really want to maintain. So those types of lower level procedures, I feel, work best as maintenance procedures, not when you've already got really established loose skin, deep lines and wrinkles, where it's going to take you 12 of them before you're even starting to get satisfied. All right. So it's really important that we tailor the level of the collagen induction therapy procedure to what we're seeing. So if we're already seeing significant loose skin and deep lines and wrinkles, we want to start moving towards higher level procedures, not the lower level straight microneedling procedures that are just going to take too many visits to really see visible results. Topical products, of course, I get that question all the time. We certainly have medical grade skincare here at Renew. These two, I feel, work best as maintenance and collagen protection procedures. By the time someone comes to see us, they're usually, have more advanced collagen loss, and it can just take too long for topicals to work really well or to have enough of an impact that someone feels really invested in it. And certainly topical agents, I don't care what they say, on the internet, or the commercials, infomercials, whatever it is, I have never seen, and I've been in aesthetics since 2005, I've never seen a topical product lift anything, ever. I don't care what it costs. I've never seen it lift. So please just understand that there's a lot of misinformation out there, and that if you really need tightening and lifting, it's not going to be about something that you're putting on your face. So collagen induction therapies, when we talk about microfocused ultrasound, Sofwave actually is not the first microfocused ultrasound procedure out there. The first one was L-therapy. It was FDA cleared in 2009. We performed L-therapy at Renew MediSpa from 2013 until just recently in 2023 when we replaced it with Sofwave. So it's not completely new technology. It's just been refined, advanced. Basically Sofwave is blowing the doors off of what we saw before with L-therapy. And fortunately, it's doing so with less pain, and the results are happening quicker than anything we saw with L-therapy before. So Sofwave essentially represents the next level in microfocused ultrasound. It's a big improvement. We don't even perform L-therapy anymore. And Sofwave itself came out in Israel, just so you know, in 2017. Technically got its FDA clearances in the US in 2019. I think it launched more in 2020, but we brought it into Renew in 2023. So I'm going to launch next into a brief video to show you what it's all about, and so you can hear from some patients who've had the procedure done and see a little bit about what it looks like.
Sofwave is a multi-award-winning device. In fact, probably the device with the most awards that I've ever brought into Renew. It's been proven to deliver remarkable results with even a single session and with little to no downtime, which really sets it apart from most of the other higher-level skin resurfacing and tightening procedures that we're able to perform non-surgically. And I'm going to show you in this video how that's accomplished. It has numerous FDA approvals, or actually clearances, and again, more FDA indications right out of the gate than any other device we've had. And there's more on the way. I heard lip lifting is coming, and we've already seen that result in our clients, so I'll show you that going forward. FDA indications, just so you know, is no easy feat. This means they had to present the clinical studies required, present the evidence to the FDA of not just safety, but also actual proven clinical result. And it had to be significant. So not just like photos of improvement, but actual clinical measures of the degree of smoothing, measured collagen content of the skin, how many millimeters of lifting there were, etc. And so you see those FDA indications, or clearances, I should say here. Submental lifting, meaning it treats that double chin region. Eyebrow lifting, improvement in fine lines and wrinkles. improvement in lax or loose skin of the upper arms, improvement in the appearance of cellulite, which is through its skin tightening effect, not through cutting the cellulite bands. It has been proven to treat acne scars and also to lift the skin of the neck, and we'll show you examples of that. Ultrasound is unique in its ability to deliver the necessary heat to stimulate the fibroblasts, again, without significant downtime. Now, you might have had an ultrasound for medical reasons in the past, and in those instances, the ultrasound energy was not focused. It was delivered diffusely and in a manner to allow the medical professional to visualize structures and or blood flow in the body. In aesthetic devices like Sofwave, that energy is deliberately focused in order to generate heat, and that heat has to be of a very specific temperature in order to stimulate the fibroblasts, which will then restore the lost collagen and elastin. And it's focused in such a way to skip over the surface of the skin layer entirely, so we don't have to disrupt the skin surface, we don't have to microneedle the heat in, we can deliver it with focused ultrasound into the deeper skin layer to generate the injury that will kick the fibroblasts into action. Once activated, those fibroblasts again produce the collagen as part of your healing response, and this is what produces the smoothing, the tightening, the improvement in scars, etc., that we see with the Sofwave procedure. So let's look at what it's like to have Sofwave done. It's common to use an eyeliner pencil to mark off the regions to be treated, to divide them into sections of a specific size. This helps us deliver the treatment evenly with the correct amount of overlap of pulses and to stay on track with our passes being delivered, how many times we're going over the skin in a certain area and in what direction. For this client, Rebecca, we're treating the full face and neck. If you see an area marked with an X, it might be avoided or treated cautiously because of potentially sensitive nerves in that treatment zone. Now, we do treat in the glabella region at Renew, the area between the brows, and that's a great way to improve those angry 11 lines that don't always completely respond to Botox. In addition to smoothing lines on the forehead and in between the brows, Sofwave will tighten the skin of the forehead, leading to the brow lift that we mentioned, which is one of those FDA indications. In addition to the lifting handpiece, we have the smaller, precise handpiece, which is used to smooth and tighten the skin in smaller, more delicate areas, such as under the brow and immediately under the eye. By pulling up on the brow or down on the cheek slightly, we can treat even more of that crepey skin and really get to nearly the lash line with the Sofwave Precise handpiece. Treating the cheek region will benefit the client in many ways. Sofwave will smooth the fine lines in many regions, in the mid-face and the lower face. It's also going to tighten the skin, so we'll see a lift in the cheeks. We'll see an improvement in the nasolabial fold, also called smile lines, and more definition in the jawline. Both the lift and the precise handpieces can be used in the entire perioral region, which is treating things like deepened corners of the mouth, what we call the marionette lines, and those vertical lip lines that can be very resistant, don't completely respond to Botox. And also, we can't get all vertical lip lines with filler without over plumping. So this is a great way to get a really smooth appearance in the skin around the lips. We then move down to the neck if that's part of the treatment plan that day, once again for both smoothing and tightening effects. This is a great way to treat the so-called double chin or turkey neck, again, non-invasively and without downtime. Patient comfort is important during any aesthetic procedure, and with Sofwave, we accomplish this in a number of ways. We use a cold air chiller directed at most of the regions we're treating, so that's very helpful, and most clients actually only need that. But some clients also like to use Pronox, which is a light form of laughing gas. It relieves discomfort, it relaxes the client, and it's out of your system in 15 minutes, so there's no problem driving home after the procedure. Now, occasionally we do have clients who are more sensitive than average. I happen to be one of those. And for them, we can perform also localized temporary nerve blocks, especially around the forehead, eye region, sometimes around the lip area as well, to further enhance their comfort. Once the treatment is concluded, and particularly if we've worked on the upper face, we may elect to have the client spend 10 minutes under our TriWave LED light therapy device with the setting on near infrared light, because this reduces swelling and puffiness. We'll often do this if the client has had that upper face nerve block, because the nerve block tends to add to the swelling post-procedure. So let's hear what Rebecca had to say about her experience.
I've been coming to Renew MediSpa for as long as they've been open almost. I love coming here all these years because I feel like I've had procedures done here, but it's very natural. They never try to make you look like something you're not. You still always look like yourself when you're when you leave here, but you feel better and you look better. I've done Botox, I've done some filler, I've done laser treatments, collagen production procedures that they have here are things that I really focus on doing. Everyone is very friendly, professional, is number one professional. Having these different procedures and different treatments over the years has given me the confidence that even though I'm aging, I still am happy with myself when I look in the mirror, when I go out in public. And that means a lot to me. By far, the Sofwave procedure that I had done today was the easiest, the most comfortable, and the most painless procedure I've ever done here at Renew MediSpa. I'd come back any day to have this done again. I have no problem going outside and going to the store with no makeup on. At 54 years old, I am very proud of what I look like, and a lot of that is the confidence that I've got from being here all these years and having the different procedures that I've had done here.
We don't yet have progress photos for Rebecca as we just performed her procedure the other day, but let's look at one that we do have currently and see some example results. This is a great progress result for our model, Alexis. Alexis is, I believe, 48 years old, and I realize she's got some makeup on the right, but we're not looking at, spots on the skin or things like that, and not so much lines and wrinkles, but more on her lifting effects. So let's take a look at those. To begin with, you'll notice her under eye region, what we call the tear trough, appears to be less deep. Her cheek has actually picked up in the area. Her nasolabial fold is lifted, and because of that cheek lift, her under eye is getting better support. For her jawline, you can see on the left that she started out with a little bit of jowling. She was getting a little bit squared off in the jawline and getting that development of a double chin look, which was really bothering her. On the right, you can see that her jawline contour is looking much more oval and that the piece of hanging skin under her chin is almost completely lifted. And finally, on the neck, you can certainly get the sense there that the skin is tighter, it's getting smoother. Again, this is only a 1-month result, and we expect her results to continue to improve for up to 6 months. In the next image of Laura's eye region, if you look closely at this zoomed in photo, you can likely appreciate that the tear trough is less deep, that the fine lines, the crow's feet lines, have gotten significantly smoother. And again, this is not even a 3-month result. This is a partial result around 6 weeks. And if you look at the skin that is just under the tail of her eyebrow, again, you'll notice fine lines in that region have nearly completely gone. It may be hard to tell the lift because of her lashes, but Laura will tell you that these days when she goes to put makeup on, she's actually not having the skin under her brow get in the way as much. So she's noticing a lift in that region. And again, not yet her final result. Here we have one of many really nice results posted by the Sofwave company. So this is not a Renew client, but what I love about this is the changes that can be seen as early as 6 weeks. This is a remarkable result for this lovely woman. Again, we've got makeup going on in the after picture, but let's kind of look past that. I want you to appreciate that even in 6 weeks, her eyes look more open. Her cheeks, it almost could be a cheek filler look, but it's not. It's clearly they wouldn't have posted this if she had something else done. The corners of her mouth are starting to get more lifted. What we call her marionette region near the corners of the mouth is certainly improving. You're definitely getting a sense that her jawline is going from squared off to approaching that more oval, rounded appearance. And I want you to look closely at the change in the neck, which is really remarkable. Now, it's important when looking at before and after photos, and if you're looking at improvement in the neck, that you look for where the nose is in relationship to the earlobe during a photo. Because if someone takes a photo and their nose is lifted in the air, you can fake a better neck that way by stretching up. But she's clearly not doing that. We can see in the photo the tip of her nose is perfectly lined up with her earlobe, which is a nice neutral position for photographs. And wow, look at the neck on the left and the neck on the right. So I imagine she now looks in the mirror and is like, that's me. That was just what I looked like, 7 years ago. So again, remarkable that we can achieve this type of result non-invasively and with little to no downtime. And even so quickly as 6 weeks.
I'm here for my 1 month follow-up after my first Sofwave treatment, which was absolutely wonderful. So biggest area of concern is neck and lower face. And looking at the photos that were taken today at 1 month, it's amazing to see what is starting to happen. I'm excited by what's happening, and I'm looking forward to a second round because my neck, again, being my primary concern, I think that's the place that really shows my age. I can see that I'm getting great results. One thing that I thought was truly amazing is that I also had the under eye area. I did the full face, neck, the whole deal. But the thing that I thought was most amazing, it was immediate, was underneath my eyes and around my eyes. I felt like my eyes were opened up and it was so smooth under there. I was absolutely, just couldn't believe it. I walked out of here and I could see those results immediately, and they're only continuing to get better. So I'm very, very pleased with the Sofwave treatment and the results that I'm getting from the Sofwave. It is absolutely an amazing process. And the thing that I liked is that there was no bruising, there's no downtime. The Sofwave process, you walk out and you know that you've had a treatment, but you're not puffy, you're not bruised. The Sofwave is definitely, the name definitely describes it well as far as being something that is not invasive or not anything that Sofwave is not going to leave you with any downtime. You can go right back to work or whatever you have planned for the rest of your day.
So what I love with Catherine, she was literally just in, and she actually came in asking me about thread lifting. So she had done the Sofwave procedure, but she had also discussed thread lifting with our consultant here at Renew. And she's like, should I book that? I mean, I'm loving the Sofwave. What should I do? Should I do this other procedure also? And in honesty, I told her yesterday, I was like, you're getting so much benefit from Sofwave and it's so soon in, unless you're in like a super rush. Cause I mean, we love our thread lifting. It does give you that immediate like fat pad repositioning, but she didn't have an event coming up. It wasn't like someone was getting married or whatever. I said, you know what? Why don't you sit tight and not spend money on threads, because we knew we were going to do your Sofwave a second time anyway because of the degree of loose skin on the neck. Why don't we sit tight and just see what the ultrasound, what the microfocused ultrasound is going to do for you? Because I think there's at least a 70% chance that you're not even, once you've seen the results of 2 sessions of this, you're not even going to be reaching for threads. You're not even going to be looking for something else. So why put money in that pot now unless we're in a super rush? And she was really comfortable with that. And so we just, planned out her second session of ultrasound. So let's go through some frequently asked questions. One that comes up, of course, always with procedures is safety. Sofwave has actually won a safety award in the UK. It is exceedingly safe. There haven't been adverse events reported. It's not possible really for it to damage fat in the face. It's not going to the level where the fat is or where the blood vessels are that are of any significance. So we're not worried about that. It has contact cooling, so it's able to skip the heat on that surface layer where we don't want to burn the surface layer. That's all built into the device, built into the procedure. It's really not anything to be concerned about. We certainly at Renew have done a whole lot of procedures here. We've had 0 side effects of anything like that. It is beautifully safe for all skin types, and that's not true of things like laser and such. So if you have a darker skin type, olive skin, Indian, black, no matter what have you, it's not an issue. We can treat you with Sofwave. It's also safe for sun exposed skin and for skin that's going to be in the sun. So if you have a vacation planned, or if you're already tanned from a vacation, or depending on the time of year, it really doesn't matter. You can have Sofwave done year-round and regardless of whether you're tan. The preparation for Sofwave is pretty simple. We ask that you arrive with a clean face. We don't want any makeup in the treatment zone. And by that, for treating, cheeks, et cetera, around the eyes, we don't want eyeshadow. We don't want foundation on. Also, ideally, no mascara because it tends to get messy when we're working around the eyes. As shown earlier, sometimes I'll do injection lidocaine in some regions to enhance comfort. That is entirely optional. You don't have to have that done. Most people are not having it done, but every once in a while we get someone who's super sensitive like moi, and that injection lidocaine really does help a lot. So that's always there as an option. And as you saw, the Pronox, we have a couple of Pronox devices here also, if anyone needs that. For men, a close shave of the treatment zone is necessary. So, the goatee, the mustache, those are not in our way. But if you want your jawline treated, we're going to need a clean shave in order to get that accomplished with Sofwave. Next most common question, how many sessions will I need? Again, Sofwave has been showing us remarkable results in a single session. However, If you're in your 50s plus or have advanced, deep lines and wrinkles or significantly loose skin, you're going to probably be looking to do more than one session. So we always want to set expectations to be realistic. So you may need a second session. It really depends on your starting point and also what your goals are. Smokers in general tend to have a less robust response to collagen stimulating procedures. So if someone smokes, they're going to be more likely to need more than one procedure. And that second procedure doesn't have to necessarily be as big a procedure as the first. So we have a fair number of people who in their first session are doing, let's say, full face and neck, starting at the hairline, going all the way down to the collarbone. And as a second session, maybe they'll only need a second session on their neck, or maybe they'll only need a second session on their under eye region. I mean, we can tailor a second session to be a smaller area if you really don't need the whole boat done all over again. So I think we just make that decision going forward, again, depending on, your goals and where you're at. Downtime, fortunately, very little. Minor redness, I'd say same day. I'd say honestly, within the hour. I mean, we pretty much do full face and neck. And by the time someone's checking out at the desk, they're no longer red. So that goes away very quickly. Puffiness around the eyes can occur. Again, it's more noticeable if someone does the nerve blocks because that adds some fluid around the eyes. It's less noticeable if you don't do the nerve block, but that's possible. But in general, globally speaking, I'd say this isn't something that you need to plan around a social engagement. As our client had said, you could go to work like right after. And for the most part, not even have anyone notice that you had anything done. When you see results, fortunately with Sofwave, it's fairly quick. So we're seeing noticeable results. And by noticeable, I mean like you can compare photos and see the difference at 3 to 4 weeks for sure. We tend to book follow-up photos at 3 months to check progress. Technically, you could see continued improvement for 6 months. So usually what I say with respect to that is if someone's more like 35, 40, they're probably seeing most of their result at that 3-month period. Maybe they're going to get another 10%, in the subsequent 3 months. If someone is more 55 and above, then I tend to adjust that down and say, well, at 3 months, you're probably seeing 75, 80% of your result. You may get another 20% extra if you wait another 3 months. So deciding when or if to do a second procedure, again, is going to be kind of up to you. If we already know out of the gate you're a 2-procedure person, you could have 1 procedure done and then 4 weeks later have it done again. Like there's not a specific waiting time, but you are going to keep seeing results. On the other hand, you may be someone who's more like, nope, I want to do a procedure and I want to wait the full 6 months. I want to know that I've seen everything that procedure was going to do before I do it again. Then you would wait 6 months. So it's a little bit adjustable there. Timing around other procedures is another common question. If someone wants to get Botox, regardless of brand, we're not going to put Botox in an area that we've heated on that same day. We're certainly not going to put Botox in an area and then put heat right on top of the Botox. It's not that it's dangerous. It's just that the heat could inactivate the Botox protein. All right. So if you just had Botox done, Jeuveau, Dysport, whatever the brand, we'll probably have you wait a week and then do your heat-based procedure. On the other hand, if you do your Sofwave today, you can have your tox done tomorrow. As long as we're separate from the heat, we don't care about that. Dermal filler is going to be an it depends sort of thing. Most dermal filler is actually placed deeper in terms of the tissue level than where the Sofwave is actually treating. So sure, it's possible if someone has filler placed very superficially in that first, 1 to 2 millimeters of skin, and then you heat over it, will you break down some of that filler? Yeah, you might break down some of that superficially placed filler. But on the other hand, then you're going to replace it with collagen. So, do you really care? So you'll find different recommendations probably if you Google this, when can you do ultrasound after filler? But just understand that, it's probably a better question for us to ask individually here in the medical spa for you, for your specific situation, knowing what depth your filler's placed at and when. We can tell you, that's never going to reach that, or that might affect that, but we don't care. Or we might tell you, okay, why don't you wait a couple months and then do it? For PDO threads, for thread lifting, we'll probably tell you to wait a month. That's not because the heat is going to affect the threads at all. They're completely different tissue planes. That has more to do with, we like for there to be a period of time if someone's had threads where we're not pressing on the face with pressure that might cause discomfort, really. That's the main thing. This slide is better titled contraindications. If someone has an infection or an open wound in an area, that's a contraindication to any kind of energy-based treatment. You want to clear the infection or the open wound before you do a heat-based or an energy-based treatment. Certainly, if we feel that someone's expectations are not realistic, we usually back off and say, you know what, maybe you should talk to a surgeon. I don't think this procedure is going to do what you really want, which is more like cutting and removing skin. So we're always on guard for that. Technically, these procedures will say precaution, implanted cardiac device, some sort of superficial implant in the area. It's not usually an issue with the face and neck. But if we were treating a chest, which we can do, if someone has pacemaker wires or something, superficially placed, that may be a contraindication. So we could certainly speak with someone, specialists, cardiologists, et cetera, and determine if they think that superficial microfocused ultrasound treatment is going to in any way impact any device that they've placed or wherever they've placed it. So that would have to be dealt with on a case-by-case basis. Smoking status, as I mentioned, smokers will respond less well to stimulating procedures in general. They also burn through collagen more quickly. So we always kind of throw that up as a precaution when we're trying to do a stimulatory procedure. And the same thing with poor general health. So if you're someone who is undergoing active chemotherapy, your body's already being called on to heal and to respond to something else. And maybe it's not the best time in life to be calling on your skin to heal in response to a procedure. So that's why we throw that up there. Provider experience is an interesting question. This actually came up on the website Real Self recently. I had answered a question about this with respect to Sofwave. I would say provider experience does matter. Sofwave and even Ultherapy, back when we did that, this is not what we call a plug and play procedure. All right. This is not where, okay, everybody just gets the same procedure. You just hook them up. You make sure the applicators are in the right spot. You hit a button and the machine takes over. Okay. That's not the case with Sofwave. Sofwave is very much a customized procedure. We're deciding not only the energy level, we're deciding the number of passes in an area, the distribution of those passes. I tend to draw a lot on the face, as you saw in that video. Listen, a provider doesn't have to draw as many lines as I draw to do a good procedure, but I use those visually to keep me on track. But you want a provider who's going to be meticulous about how they're delivering the energy, and that they're going to deliver the right number of passes to achieve the goal for that client, because there's discretion there in terms of how many passes you're doing, and more energy is going to stimulate more collagen. So it's important that you feel comfortable with who's doing the treatment, that they certainly apply the passes evenly, that they're putting the settings in appropriately and giving you a nice, even, full treatment. But I would say safety, that's not so much the issue, because this device is exceedingly safe in any hands, I would say. Cost always comes up, so I'm going to throw this out there. This cost information is on our website. If you go to renewmedispa.com and you go to Face and then you go to Sofwave, you'll see our treatment options and the price per area. So not surprisingly, the cost depends on how large an area you're doing. So you can look at a chart like this and decide how much of an area you want to treat, whether it's just smoker's lines or you want to go full perioral, whether you want to treat the whole upper face or just the under eye, whether you want to treat full face and neck or just the neck, or, we have all different combinations. We're trying to be as flexible as possible. And we also are treating acne scars. And we're also now, as of this month, moving down into body treatments that I'll discuss briefly. So that's pretty exciting as well. Upper arm skin laxity is one of the more recent FDA indications for Sofwave. It is recommended that 2 sessions be done for loose skin in the upper arms. In the studies that were done for the FDA, those sessions were really just 3 or more weeks apart. So they were done fairly close together, and really significant improvement, about 93% improved or very much improved after 2 sessions. So we're excited to get started for that. We'll also be treating above the knee. This image on the left is not a Renew client. This is a provider in Florida, as I'm told. The treatment zone is marked in that faint red pencil or marker. And you can see that 3 months after a single session, that's really a remarkable smoothing and lifting result. And what looks like they tried to match the lighting in the photo pretty well. And Sofwave was actually got the Beauty Award for Best Treatment for Cellulite for the New Beauty Magazine Award. It's not treating cellulite bands. I want to be clear about that. Cellulite, I should say, is sort of multifactorial. If you look at the diagram here on the right, it's a combination of enlarged fat cells, connective tissue bands that are pulling down, and then also loose skin. Okay. So Sofwave is addressing the loose skin aspect of the cellulite, and that's where it's going to improve it. It's not going to affect the connective tissue bands, and it's not going to shrink the fat cells. So we want to be very clear about that. Acne scars is another exciting application. It does have the FDA clearance, the FDA indication for acne scars. Now, before Sofwave, we were primarily doing CO2 laser skin resurfacing, and that still remained the gold standard for acne scars, especially really deep ones. But CO2 laser has very substantial downtime, and not everybody is up for that. So we're now offering Sofwave as an alternative. We've got some model opportunities. If you're interested in treating acne scars with Sofwave, you can do some cost savings. If you're interested in sharing your before and after photos, because we're excited to show what that can do. I just had a client in today, so we just threw this slide in, who had done a Sofwave session 2 months ago. Again, this is a no downtime treatment, and you can see in that area marked with the arrow how much smoothing and lifting that she's getting. In general, acne scars, no matter what we're doing, we recommend 3 sessions, but even 2 months after 1 session, she's thrilled. She had a follow-up booked for next month, and she said, I don't want to do a follow-up. I want to book the next treatment because I'm impressed. So we're excited for her, and we're excited to be able to offer something for acne scars that does not have downtime. Just so you know, we do have our app, which is renewmedispa.repeatmd.app. It is a way that you can search our services. And if you want to finance treatments through the app is where you would do that. You would select the service, let's say Sofwave, that you want to purchase. You would select a firm for your payment method, and then you're deciding what your payments would be. There would be 0% interest option, and also, of course, interest-bearing options. So that's pretty much everything I have to say. I'm going to check questions in the chat shortly. You can contact us, as you see here, either by phone. You can go to the landing page for our specials. You can download the app, go to renewmedispa.repeatmd.app. Don't forget to save it to your home screen, because then it gives you a little icon which you can click in the future and search easily. And we have certain, like a rewards program like through that as well. Or you can certainly drop by Renew MediSpa, and we're happy to field your questions. If you want to contact me personally, you can email me, lisa@renewmedispa.com. If you have questions that aren't answered when you watch this live stream, or sometimes people will send selfies and say, what do you recommend based on these photos? I'm happy to field those. So Denise has asked, is there harm to the thyroid? The thyroid gland is much deeper than where the Sofwave treatment is actually being delivered. So Sofwave treatment is being delivered at that 1.5-ish to 2 millimeter depth. So that is way superficial to where the thyroid gland is. So we wouldn't be impacting the thyroid. The next question I see is, does everyone have the same training as you? Mine is with Victor in February. The answer is yes. We all trained on it at the same time. Victor actually did my Sofwave this past Monday. So I trust him. I trust Julie. No one does a procedure at Renew unless I would have them do it on myself. Let's put it that way. So we're all doing the same settings, the same, number of passes in relationship to what we're doing. So I would say, yes, if you're getting it done here, you're getting the same level of service, regardless of whether it's work with myself or with one of my nurses. Fake tanning, that's an interesting question. I mean, I would say we haven't done a Sofwave on anyone who had fake tanner in their skin. I wouldn't imagine that it would affect that. It's certainly not, there's not an issue with danger of any sort. But I don't know if there might be some kind of color change or if the tan might wear off sooner or something. I think that's going to be interesting to see as we get into maybe warmer months someday. But I would say there's no danger, in terms of a fake tan. The next part of that question is, do you need to stop products prior to the procedure, such as retinol? Retin A would be another one. There are some skincare products which tend to make the skin more sensitive, some retinols, Retin A. So if you'd like to stop that, say for 3 days prior, that's about how long those products last in the skin. That could be a good idea. It's not a requirement. It's not necessary. It's not a safety issue. But if you're someone who's using, let's say, Retin A, and you're kind of red and flaky coming in, and then you do a heat treatment, you might stay redder longer than someone who wasn't using Retin A. I mean, I'd say that would be the change in downtime. So instead of your redness being gone in an hour, it might last a day, something like that. But it's not a safety issue. It wouldn't be something where we would say to someone, oh, you've used Retin A, you need to go home. That would not be a thing. So we're not particularly concerned about that. The next question says, how long does it take? A full face and neck. Well, first of all, the area that's going to be treated numbs for an hour with topical lidocaine. So you have 1 hour of numbing. And then how long it takes, understandably, varies according to how large an area. But I can tell you that a full face and neck takes about 2 hours if we're doing a 3 to 4 pass treatment. So we're doing a heavier treatment in someone with more advanced lines, wrinkles, loose skin. So you can back off from that if it's someone who's younger, someone who's doing it more preventatively, someone who's 40 years old, they only need like 2 passes. That could be done in 45 minutes. So you might see advertised, on the internet, Sofwave 45-minute treatment. If they're talking about Sofwave full face and neck 45 minutes, they're talking about a basic 2-pass younger client or preventative treatment. That's a 45-minute treatment. Again, a more advanced 3 to 4 pass treatment is going to take twice as long. And we're doing a lot of those. So they're taking us closer to 2 hours. Jean is asking, how does it work to use this procedure at the same time as biostimulators? So usually when we're talking about biostimulators, we're talking about biostimulating like fillers like Radius and Sculptra. And those are going deeper in than where the Sofwave treatment is working. So microfocused ultrasound is really working in that dermal layer, that surface skin layer, whereas our biostimulators are working deeper to create volume, right? So Sofwave won't create volume. It won't plump anything. I mean, it can look, as I said earlier, it can look like a filler effect because it lifts the cheeks, but it's not actually adding volume to the cheeks. So our biostimulators, we're still going to need to use if we need actual volume. And the analogy I usually use with volume and smoothing is, think of it like a mattress and sheets, right? And so our volumizers are filling holes in the mattress, right? If you've got chunks taken out of the mattress, you need to fill those in. Whereas our smoothing and tightening procedures, we're tightening the sheets, all right? We're affecting the sheet level, not so much the depth at the mattress. Rachel is asking about tightening upper abdominal area. The answer is yes. I mean, we can and should be able to use Sofwave on any area of the body. As I mentioned earlier, it's indicated for arms, it's indicated for thighs, even the back of the thighs for cellulite. It's being used above the knees for tightening there. We are now booking abdominal area. Some people will be 1 treatment, some people will be 2. This is only for crepey skin. It's not going to have any impact on fat at all. But if you have loose skin in an area, this is certainly something you could opt to do. And you'll find information for that. We're doing a promo on body areas that should be on our specials page. So you go to renewmedispa.com, go to specials, and there should be information there about treating body areas and what we're doing for model calls for that. Samantha's asking about upper eyelids, concern for vision complications. Absolutely no visual complications. We are only treating skin that is on bone, so we'll be pulling the skin up and treating on bone. When we're treating the under eye area, we're pulling the skin down and we're treating on bone. We are not treating over the eyeball at all, and there would be 0 anticipated risks for visual complications. Allison is asking for full face, how many passes would be needed? Again, it's going to depend on what we're looking, what's going on that face. So if someone is younger and has very mild collagen loss, we can easily do 2 passes and be done. Someone else, like we're treating more advanced collagen loss, looser skin, deeper lines and wrinkles, that's going to be a 3 to 4 pass treatment. That's pretty much what will cut it off. We won't do more than 4 passes because we don't want to stress the skin out too much. It's not like you can say, oh, well, just go do 12 passes. We're not going to do that. We don't want to run into complications from skin that we stress too much. But we know we can very safely treat up to 4 passes, depending on what the client needs. Catherine is asking how long the results last. Another great question. In general, when we stimulate, when we put collagen back in the skin, the rule of thumb is collagen lasts 5 to 7 years. All right. What that really means is that, whatever effect, that you've had from the procedure or the procedures you've done, if you did nothing and just waited for all of your benefit to be gone, it could take 5 years before you were back where you started. Okay. Most people don't want to go that route. Most people, once they get tighter and smoother, they actually want to maintain that and do it sooner. But 5 to 7 years is the rule. Realistically, what we're recommending, let's say to our, 30 to 40 something year olds, is this is probably something you're going to do every 3 years. to our 50-year-olds, and we're saying, well, you're probably going to want to do this every 2 years. And if we've got someone who's 70 and above, well, maybe this is going to be every year, year and a half. The reason is not failure of the treatment. The reason is the older you are, the faster you're losing collagen. And so we need to do more to keep you, we need to do more to keep the tank full, right? So it's going to be, the answer is going to depend on your age, your lifestyle, how much sun you're exposed to, are you using quality skincare, that sort of thing. So I think at the end of the day, the right answer is it depends on you, on how fast you lose collagen, on what else you're doing for your skin in terms of maintaining your collagen. If you're using good skincare, all that, you're going to extend the life of your results. We're actually for 2024 offering all of our Sofwave clients 15% off Neocutis skincare products all year long. We want to encourage you to, do your home regimen that's going to extend that collagen life so that you don't have to do the procedure as frequently. Would a full perioral treatment, Lori's asking, be enough to smooth nasolabial lines, or would larger area would be required? Full perioral is more focused on etched lines around the mouth. If you actually want to lift the nasolabial fold, you're going to need to do that lower face treatment because we need the tightening all the way through the cheek in order to actually pick that fold up. So I would say lower face treatment. Our lower face and our full face treatments, just to be clear, do include this section under the chin. This is called the submental area. So we include that in anything treating this zone. If you're going to go full face and neck, the end neck means we're going to go all the way down the neck to the collarbones. All right. So that's what the added neck means. But all of our lower face and full face treatments will include this little section of skin that's a bugaboo for a lot of people. Charlene's asking, I'm having microblading touch-up and then seeing Victor. Will that be okay? That's perfectly fine. We don't need to go into the brow hair or the brow line, so we're not worried about that. Amy has asked, I get Botox for migraines. It leaves my eyes looking saggy. Would you recommend more Botox, or could the Sofwave fix this? The issue with Botox and sagging brows generally has to do with Botox relaxing the forehead muscle, all right, the frontalis muscle. So this muscle above your brows is the only muscle that's actually lifting your brows. And a lot of people will get that muscle injected for migraine control. The problem is when that muscle relaxes, the brow drops, okay? So unfortunately, it's sort of a rock and a hard place kind of situation. So yes, Sofwave, because it's smoothing and tightening, can tighten and lift that skin. And I'm not saying it would completely undo what the Botox is doing with the brow position change, but it would certainly be expected to help. And someone asked about emails. Again, you can email either Lisa, Lisa, at renewmedispa.com, or our general email is info@renewmedispa.com. Either one, I'll see. If you have specific questions, if you want to submit selfies for review, if you're already a Renew client and we have pictures here, you can also email us and just say, hey, I had pictures done there last year. Can you look at them and make a recommendation? I do that all the time. We pull up your pictures. I'll look at them, or sometimes Victor and I or Julie and I will look at them, and we'll certainly email you back with what we see looking at your photos and what we'd recommend, and we can go back and forth that way. So I think that's pretty much everything that I had to cover. I don't see any other questions here. So I'd like to thank you so much for spending this time with us. Keep an eye on our website. Again, if you go to renewmedispa.com and then you click face, and then in that first row off to the right, the Sofwave click box is there. Watch that page, because as we have more people come through, we had quite a few people when we started doing these treatments in October who agreed to allow us to share their before and after photos. So as we get those people coming in at the 3-month, 4-month, 6-month point, we're going to continue to keep adding before and after images. I think it's really important that you see images of our clients, and we'll also, in another few months, we'll start having some body images if you want to watch that, sort of happen. But that's where we showcase what results we're getting with any technology. So you just scroll to the bottom of that page to the before and after gallery, and you'll see exactly what kind of differences we're making here in terms of non-surgical aesthetics at Renew MediSpa. So if you're not already a client, we welcome you to come by anytime. We do free consults. And if there are any other questions, I will be happy to field those via email. Have a wonderful rest of your weekend.